You're welcome back again to my channel. We want to talk about bleeding after sex. Most women sometimes bleed after sex. Why do you bleed after sex? If you notice you are bleeding after having sexual intercourse with your partner, it is very, very important for you to take a step. It is not something with your partner and you don't have your period. It is not supposed to come anytime. It is not anytime soon. You are not expecting your period and you just find out that you are seeing your menses after or bleeding after sex. You may be experiencing vaginal bleeding, which is very common. And is it normal to bleed after sex? No, it is not normal. You understand? It is not normal. And I want to tell you that vaginal bleeding after sex we call it postcoital bleeding. That is bleeding after sexual intercourse. And it can be scary and it can put you into anxiety, but it's also fairly common. It affects about 90% of people who get a period. Then, of course, there is probably no cause for concern, but at times it might be a pointer or an underlying problem that somebody has to take into cognizance. And it can be as a result of ordinary infection. In rare cases, it might be a sign of cervical cancer. Cervical cancer is just the place between the vagina and the uterus. Even though the bleeding after sex is fairly common, that does not make it normal. And if it happens once, you might say, okay, and the blood is just minimal, just only light spotting. You might say probably it is not serious. But if the bleeding is heavy, you understand, and it lasts for a few days, or it happens, often, it could be a sign of something more serious that could need urgent doctor's attention. Then, what are some of the likely causes of bleeding after sex? Though we have said that it's common, but most of the common causes of vaginal bleeding after sex that we want to talk about both start in the cervix. The uterus has a place that is like an entrance, from vagina to the uterus, which we call the cervix. It is a narrow tube-like end of your uterus, you understand, and it opens it opens into the vagina, opens when there is delivery, opens during menstruation, opens up to receive the male organ during sexual intercourse, and one of these causes can be irritation or infection of that place called cervix. Now we call that cervicitis, that is inflammation of that cervix. This can happen because of a sexually transmitted infection that you need to get treated, or you have not been properly treated. At times you are treated, you are not treated right, like chlamydia or gonorrhea, or it can happen from an infection, you understand, that is not even related to sexual sexually transmitted infection, like yeast infection, for example. You understand, it's not directly centrally transmitted infection, but it can happen as a result of this infection. Then why do I bleed after sex? Is it just normal? Is just apart from that, if you notice that after your period, it is not supposed to come anytime. Like I said, and you are experiencing this, you should do something. And a common cause, another reason for bleeding after sex is cervical polyps. They are just an abnormal growth. They are just small, about 1 to 2 centimeters. You understand that they are in the cervix. They often appear at the opening of that cervix. It's just like a tube like. They appear most of the times there. Most of them are not cancerous. They are not cancerous. Your doctor can remove them during an appointment. It's not something that no cause for alarm when we're talking about that. Then other causes of vaginal bleeding after sex, some are serious, some might not be serious. One is friction during sex. So before sex, ensure there is enough foreplay, and if there is not enough foreplay, there should be adequate lubrication. You can use the KY jellies, water-based gel to make sure the place is well lubricated. Normal lubrication, normal uterine bleeding. There can be normal uterine bleeding if you are just beginning your period. You understand? You're just starting. There might be period, or if your period has just ended, you understand, there might be spot, at times the cervix, if the uterus has not cleared itself, the endometrium of all the blood or post menses, it will not call the mouth of the cervix will not close like a lip. So at times, if they see something, the cervix will make sure that it opens so that the bleeding can come out. So maybe 1 or 2 days after menstruation, you see that there is no cause for alarm. And at times, there is something we call genital sores, but there's one sexually transmitted infection we call herpes simplex, or another condition. Other conditions that can cause it. We have something we call cervical atropine, a condition when the inner lining of the cervix, you understand, the cervix that we say is between the uterus and the vagina, pokes through the cervical opening and grows on the other side, just like when we're talking about endometriosis, other side of the cervix closer to your vagina. Then your vaginal opening, when there is a problem, as soon as the male organ is patching in there might be bleeding. Then there is uterine prolapse, when the uterus leaves where it is, because the muscles, the ligament that are supporting the uterus, they are weak, and they are coming down. And when they come down, what happens is that the uterus becomes weak, and of course your uterus sags and drop, because the ligament are weak, and when it drops inside of the vagina. And of course, one of the causes can be cancer of the cervix. That cervix, the tube, or the vagina, or the uterus itself. And it can be precancerous cell in the cervix, in the vagina, in the uterus. When we're talking about cancer, they are just abnormal cells that develop into cancer. You understand? And they replicate, they multiply at a very faster rate. That's why it's very difficult for us to see the cure to cancer, except it's gotten early. Then there's something we call pelvic inflammatory disease. It's an infection of the uterus, the fallopian tubes, the ovaries. It's a sexually transmitted. It's as a result of poorly treated or not treated at all sexually transmitted infection that now advance into all the reproductive side. Then hormonal birth control. There's some hormonal birth controls that we use, like intrauterine device that they place at the mouth of the uterus, at the mouth of the cervix, you understand, so that sperm cannot enter if it is not placed correctly, or it has been damaged by trauma to the vagina, or from childbirth or something, you understand, or childbirth or injury, you understand, there can be bleeding. If there is dryness, it can also lead to vaginal bleeding, and this dryness can also be caused by menopause. You understand? When you enter menopause, the vagina tend to shrink. You understand? When it shrinks, it reduces in size. You may have that during breastfeeding, childbirth, menopause, allergy, anti-estrogen medications, cancer, and others. Those are some of the cancer therapy and some of the things that can cause it, that has effect on the ovary. Or maybe you are the type that douches. It is one of the things that can happen to you. And of course, many of these causes are harmless and don't need treatment. Some vaginal bleeding after sex can signal or signify a serious problem that you should see a doctor right away. Every bleeding after sex, every bleeding, just not the normal sex after, and every bleeding after sex is something. If you are having every bleeding after sex, please see your doctor very immediately, because it is not normal to bleed after sex. If you have found this video insightful or educative, please join me in the next video. Bye bye for now.